Uh, Good morning or good afternoon to you all. I'm steadily waiting until you all connect. So I'm trying to see how many of you is here. Yes, we're almost there. Okay, good morning. Good morning all. Welcome to the third episode of MEDICI webinar series. My name is Marta, and together with my colleague Alessia, where is Alessia? And Pauline, we will host this. Hello, Alessia.
Yes, hi, good morning.
Hello. Together with Alessia and Pauline, we'll host this episode titled "Getting Online Can Be Life-Changing." We are from DIESIS, one of the widest European networks specialized in supporting social economy development through major national federations and national support networks in 19 countries in Europe. We are one of the partners of MEDICI projects, where our aim is there to gather and further share good practices across Europe on how to overcome the barriers to digital inclusion of vulnerable groups in our society. We do it through the variety of tools, and what we have done, we have created a MEDICI digital inclusion community, because we believe that through sharing good practices and exchange knowledge and exchange those good practices between each other and connect across borders, we can effectively learn from each other and find good solutions and inspire each other actually to innovate, and also look at those current challenges that we face all together. Digital inclusion has become a very hot topic, especially now in the light of COVID-19 outbreak. Most of us have shifted to working online, and we also observed that a lot of essential services have gone also online, such as customer service, or even some aspects of the healthcare. And they are all using those digital technologies and solutions, and promising to be more efficient and most of all to be more cost effective. But some of the people may be digital excluded and less able to benefit from it, to benefit from those services. And these unengaged people are also frequently at the risk of social exclusion. So during today's webinar, you will hear from my guest speakers, David Scurr and Victoria Mandefield, how getting online can be life-changing for the most of those vulnerable people, and especially now in the pandemic times. And that's the right combination of access and skill and motivation, and even knowledge to make digital decisions. So today you will hear two different cases from two different countries, the UK and France, and organizations that are working with older people, working with homeless, on how, and you will hear how their activities prevent those most vulnerable, and it might be directly or indirectly, from being socially excluded, and how they give them a chance basically to engage or to re-engage with society. Today's presented cases, you'll be also able to find them back in our MEDICI catalog. If you visit digitalinclusion.eu, you will find the catalog and of different cases that we have gathered so far from across Europe, that actually are working within the topic of digital inclusion. But before I hand it over to my guest, I have just some technical practicalities. So you are at the moment in listening mode. However, you will have opportunity to ask some questions during the Q&A session in the last 10 minutes of the webinar. And please submit your questions also during the webinar, and my colleague Pauline will take care of them, and then she will pass it later on to our guest. If your question hasn't been answered for one or other reason, you can go to our forum and post the question there, and our guest will answer them later on. Webinar in total will be 1 hour and with 30 minutes presentations and 10 minutes questions and answer session. So before we start, we would like to get to know you more, the audience. So we have prepared a quick polling question that should appear on your screens as I speak. Yes. So if you could participate and submit, and we see, we can get to know you, who you are. Let's see. Okay, we'll get another couple of seconds. I think we can end the poll. Yeah, so here are some results. So what type of structure do you work? So we see that there's most of you work in non-governmental organizations, so 32%, and some other. I would be also curious who is that other. But I see also cooperatives. I see public authorities and governments. So really quite a nice balance. And in terms of topic, it's really well balanced. So we see quite well balanced people with disabilities and elderly and marginalized and unemployed. So really great combination. Fantastic. And then so there are some national. So where do you work? So you work mostly on national level, local, and some of you work also on European and international. So thank you very much. So it's nice to know your audience, who you are, and hopefully we can connect more in the Q&A session. Okay, so I can now introduce you finally my guest speakers. It's Victoria and David. So welcome to MEDICI webinar, both of you. And could you shortly introduce yourselves, and then we'll start with your presentation. Victoria?
Hello.
Hand it over to you.
So my name is Victoria. I'm the founder of SOLINUM, and we are a French NGO that thinks that digital tools can be a wonderful opportunity to help homeless people and refugees.
Thank you. And David?
Hello everyone, hello from the UK. My name is David Scurr and I am Partnership and Project Manager at Citizens Online. We are a UK-based digital inclusion and digital skills charity, and I'll be sharing some of our case studies during this webinar, and it's great to be connecting with fellow European friends from the UK, so great to be here.
Great. So I'm going to start, so we'll start from David. David, could you, so you're from Citizens Online, your primary target group is you work with older people, and could you first mention and tell us actually what's the problem, what's the issue, why do you exist as an organization?
Sure, thanks, Marta. Yeah, so we're going to focus on case studies where we've worked with older people, but we work across the UK with a range of client groups. And I should maybe specify that we in the UK at the moment we've worked for the past few years as part of the One Digital Partnership, which is a national digital inclusion partnership funded by the National Lottery Community Fund, with a range of other sort of leading organisations in the sector, and we've been testing out a digital champion approach to tackling digital exclusion. So maybe I can draw on some of that later. But for the purpose of this webinar, I'll focus on a specific project we're running in Brighton and Hove on the south coast of the UK, not far from London. In terms of what the problem is, good question. If we move on to the next slide, what's the problem in the UK? We have a number of problems, well documented. Let's just focus on digital inclusion for this webinar. There's a stat here I've put on here, which is that 6 million people in the UK cannot turn on a device. So while digital tech has improved many aspects of life, we're still left with a huge number of people that are left at risk of being left behind by this technological change. So here we've got 6 million people that can't turn on a laptop, a smartphone, or a tablet. And in the UK, we've got, in terms of adult population, we've got 4.5 million people that are offline or have never used the internet. So technological change is really excluding a number of people. There's a strong link between social exclusion and those sort of vulnerable groups that are being left behind in society, with the link to digital exclusion. If we move on to the next slide, Alessia, and then one after this. Just looking at some trends, the next one, please. Yeah, great. Some trends for older people. So you've got a bit of a few numbers here, looking at the age group of 65 to 74 years. And there's a strong increase for the past decade, really. Big increase in that client group getting online and gaining more confidence in getting online, mainly through increasing accessibility and affordability of touch screen technology, which is just a more accessible way of accessing the internet. But we're still left with 3.7 million of over 65s that are offline. And just to give you an idea, that's out of those 4.5 million people offline, 80% of those are over 65s. So it's still kind of one of the main groups, if you like, that are offline when we look at the general stats across the UK. So that's the problem, Marta, in a bit of a nutshell, in a few slides. You know, lots of benefits of getting online and accessing digital tech, but still a number of people left behind, and a strong link with financial exclusion, social exclusion, and being able to access fundamental services online. I can have a look at, explain a little bit about how we try to tackle that problem in the next slide. So at Citizens Online, we try and take a kind of whole system approach to addressing and tackling digital exclusion. We call it kind of a hyper-local approach. What we're trying to say here is that it's not just a sort of on-off switch that you turn on when you're providing a service. And it's not just something that you add on or bolt on as an afterthought when you're, say, switching a number of services online. It has to be really embedded and thought through from the very kind of inception and planning stage of design phase of a service, if you like. So the 4 components we look at when we go and work with, say, a local authority or town or a city is 4 components. We've got the baseline level, which is really carrying out needs assessments in the local area, doing some mapping work and try to identify particular gaps in different demographics and different local areas. We'll then work in partnership with the key local stakeholders and local organizations in that specific area to co-design a program of support. So not coming in and sort of solving the problem for them, but working with and through existing organizations in that area to help them feel better equipped to address some of these issues we've talked about in the first slides. And then in terms of delivery, we adopt and advocate for a digital champion approach. So that's basically a network of people who might be working for existing services, who might be volunteers, to help others get online. We call them digital champions. And of course, a review process. Through the One Digital program, we adopt a test and learn approach. So quite an agile way of testing out an approach. Of course, tracking evidence and monitoring evaluation, but also being quite agile and flexible in terms of responding to immediate needs on the ground. I can give you some examples on the some work we're doing locally. So part of my remit at Citizens Online is to run a digital inclusion network in Brighton and Hove. So Brighton and Hove is a seaside city on the south coast of England. We've got about 300,000 inhabitants, we've been working in Brighton and Hove for about 4 years now. So what started off as a kind of research piece, doing some baseline research and helping the local authority and the number of community organizations to identify what were the risks in terms of switching fundamental public services online, has turned into kind of a whole network building exercise, trying to galvanize sort of local community groups and local stakeholders to tackle this issue together and to make sure that the services that we're putting online. In the UK, there's a big digital by default program agenda. So, you know, that means that your first port of call or your preferred port of call to access services is online. So that's kind of just national policy. So how do we ensure that those are accessible and inclusive for everyone? And so we adopt a very kind of collaborative cross-sector approach to doing this in different areas. So Digital Brighton and Hove is a cross-sector partnership across mainly public, community and voluntary sector, with increasing engagement from the private sector. You can see a number of organizations here. We've got over 300 organizations engaged with local digital inclusion work. There's an increasing level of engagement with the private sector, but it's primarily still organizations that are delivering public services or working in sort of the voluntary community sector level. And working together with those organizations, those kind of essential service providers that are already out there providing fundamental support for vulnerable groups that we've identified in the first few slides. It's how do we work with them, with their staff, with their volunteers, to ensure that they are aware of digital exclusion as a big problem, what the barriers are for those particular client groups in terms of getting online, and what are the benefits of getting online. So there's a whole kind of raising awareness piece, as well as working strategically with them to ensure that we're supporting vulnerable people that might not be able or might not be confident to access those online services. But we're also working strategically with those organizations in terms of digital transformation, what that looks like, done in an inclusive way, digital leadership, digital culture. So how do you start really thinking strategically about the services that you want to deliver online for those particular groups? That's kind of in a nutshell what the Brighton and Hove partnership looks like. The next slide is just a reminder that for this approach to work, what we really need is being able to build an active community of digital champions and digital leaders. We need that active engagement. So the community building aspect is really quite fundamental in terms of being able to sustain this approach. It's great to have the research, it's great to have the baseline, it's great to run some workshops, but we really need to build this sense of community and peer support to be able to do that. So we run regular network events for Brighton and Hove. Whoever from whichever sector wants to come in and join these events are welcome to, where we'll share good practice. We will link up with examples at national level through the One Digital program. We had some great examples from Scotland, for instance, visit Brighton and talk about the work they're doing, and providing that peer support and learning together. We'll also run sort of bespoke digital training workshops for staff and volunteers who want to gain some confidence in their own kind of skills level and confidence. And also specific workshops looking at online accessibility and assistive technology, and what kind of amazing free tools are out there on your smartphone, in your pocket, that no one knows about, that can really help people that might have a health condition or disability or visual impairment to access those services. That's kind of bespoke workshops. As well as building an online community, we have a Slack workspace community. So for those of you not familiar with Slack, it's just instant messaging with different channels for businesses, but like a more elaborate WhatsApp group for this particular community. And we also use Meetup as a tool to convene and run more informal events and sessions. And on top of that, we've also got online training and resources, which are provided through one of our One Digital partners. Lots of online courses, step-by-step guides about how to use tech and how to help others, for instance, older people to use that technology. How do we go about doing that? It's not just a question of giving them a tablet and logging into the internet. There's a soft skills element that we need to be thinking of when we're working with different types of groups. So yes, that's kind of the wraparound support, if you like, that the network tries to provide to organizations out there already doing a lot of work for older people, if we're talking about older people. I can give you some very quick examples. Next slide. And Marta, please feel free to interject if I'm running out of time. Yeah. So we've also built an online website, which is a kind of signposting resource for where you can find where you can get public internet access, where you can get digital support sessions across Brighton and Hove, looking at different community venues and community organisations, as well as a list of digital resources.
And this can be, David, this can be accessed by everyone that comes to your website, right? This
Yeah,
sort of information.
So it's accessible for everyone. It was initially designed for service providers, so basically people that were kind of helping, say, older people, say Age UK charity, looking to help some of their clients or services. It was initially devised for that, but then it soon evolved into a tool that could be used by anyone who was already online, but maybe with low digital skills, needing to find that immediate support, as well as a phone line, of course, because there's no point putting online resources for those that are offline if you don't have a phone line. So they can also call and ask for that support if they're not online. In terms of delivery, in terms of delivery for Digital Brighton and Hove, so I spoke about digital champions. We've got a network of over 400 digital champions trained across the city. And when working with older people, for instance, we'd be working with charities like Age UK, but also the council, the city council, who run a number of sheltered housing schemes, council housing for older people. We've got 23 across the city. So working with their services, with their teams, to look at how we can, how they can themselves support groups that maybe offline or maybe online, but with low digital skills. So that's kind of carried out through these digital champions, who might be scheme managers or support workers that have a totally different job, but they're putting their digital champion hat on when it's needed. Or it might be also volunteers who are just community volunteers who want to go out there and help. Or it could be professional digital champions. We had 2 professional community champions who would be out there trying to set up one-to-one support sessions, drop-ins, and work with local partners to do that, to deliver that support. So there's kind of, it can be a blended approach as one week champion. So you have all 3 types of digital champions working in a space to do that.
So are you directly, as a Citizens Online, are you recruiting those digital champions, or are evaluating who is actually the adequate candidate, or it's done by your local partners? Yeah,
so both. So we will facilitate, if you like, if we're trying to provide the tools, and we use a digital champion, the Digital Champions Network tool provided by Digital Unite, one of our partners. It's an online e-learning tool for digital champions. It's also a digital champion project management tool, which to help those organizations we work with to find the resources they need, find the kind of accredited courses. There's also some good continued professional development courses for those that might be looking to develop their own skill sets. So there's kind of different benefits to being a digital champion. And then we will help with the coordination and the kind of the training, running training sessions for their teams so they can get a better sense of what they're trying to do by being a digital champion, tracking the activity and keeping on top of the different user needs so that we can collate that through this digital champion network portal, which is quite really useful bespoke for this particular work. And on next slide, I can give you some very quickly, couple of very examples of activities. This is an activity we ran with the council's seniors housing project. So council housing, 23 schemes with older people. We discussed this with the partners. We tried different approaches. The one that was most successful is kind of drop-ins, one-to-one drop-ins. So piggybacking activities that were already running. So like a coffee session with some trusted digital champions, you would kind of become part of their group to help them with sort of getting online, using a tablet. So not kind of a separate thing of off you go and learn about the internet, but like just trying to integrate it in the things they're already doing, the things they're already enjoying, finding that hook. You know, it has to be fun. So if your hobby is Sylvie here on this picture, is an 88-year-old internet convert. She has underlying health conditions. She wasn't able to get out anymore. She found some crochet videos on YouTube and got hooked with that aspect of carrying on practicing her hobbies. And then suddenly she shares some of that with her friends and family. So suddenly she's onto Skype and WhatsApp, and then realizing it's a very kind of narrow usage. And then realizing as she grew in confidence with Josie, the digital champion on the picture, that it could be quite life-changing. And now she's downloading audiobooks from the library online services, and she's very confident, but she needed that initial breakthrough, if you like, tackle that initial barrier, which was mistrust, fear, lack of motivation to get involved with any of this. So the example of the seniors housing project is a very light touch kind of learning, where you kind of trying to integrate it with things they already enjoy doing, rather than a kind of classroom setup, if you like. A couple of examples on this slides here. We've got a whole bank of case studies you can have a look at, or your participants can have a look at next. Another example, a bit more structured learning, is the collaboration with Age UK, charity working with older people across the UK. They had drop-ins, so similar kind of digital drop-ins with digital champion volunteers, but some of their learners wanted to have a bit more sort of continued learning. So we ran 11 6-week courses, internet essentials for beginners. So a bit more structured, a bit more kind of classroom style, where you each get a laptop or a tablet, and you've got a digital champion kind of running different themes each week. And we ran 77 digital sessions, had 34 new learners. So you've really got to like figure out what works for your learners, and there's no one size fits all. And when we talk about homelessness groups, for instance, it will again be different, and it's trying to always work out what suits them and what suits their needs, rather than coming in with an amazing plan which you throw out of your pocket as soon as you walk into the space, because you realize it's not going to work.
Exactly. You verify along the course design and see what actually the needs of the people. That's
a couple of examples, and then if you want, we can talk about impact and evaluation afterwards. But I've got a slide on that too, and we're doing lots of stuff around COVID-19 right now, which might be of interest to partners.
We're gonna come back to that a bit later on, because also in the Q&A session, I already see a couple of questions that are also interesting, and it goes to you, those two topics that you mentioned in your presentation, especially collaboration and partnership. So I think we'll come back to it later on, and also you can give us a bit of an overview, actually, how do you evaluate and how do you actually verify that this approach actually works, because is also something interesting, because the approach is really great, because basically you go 360 degrees in the community, and you first sort of get to know the community and people who you want to actually to offer services, and then you tailor it to them rather than other way around. And I think that this is really a genius approach, and this is the approach that a lot of organizations should do before. But it's not easy. It takes time, and it takes basically practice as well, you know, and then also get right people on board, right partners, and get them into such approach. That's very challenging. Yeah, thanks, David. We're going to come back to it later on. So that was about citizens online, and I will connect now with Victoria, who will tell us a little bit different, different story. However, very interesting. So it's more about getting online, which is life-changing, but also getting right information, and being able to find right information can be life-changing. And especially with the group of people that Victoria is directly working with, and then providing those services. Victoria, it's all yours.
Thank you. So yeah, it's good.
Hello.
My name is Victoria, and I'm going to talk to you about Soliguide, which is a project by SOLINUM. We do lots of cool stuff at SOLINUM, but mainly I'm going to talk to you today about Soliguide. We are not fighting against digital exclusion, so that's an important point. We are using digital tools as an opportunity to help people. So to give you a bit of context on how it all started, I have been volunteering for years in the streets in various cities in France and abroad to help homeless people and their refugees. And every time, like the man scratching his head on the slide, I was facing the same issue, which was information. So people I met on the street would ask me every time where they could find food, shelter, shower, French classes, and sometimes I didn't know. Sometimes I gave them wrong answers, sometimes I gave them right answers. But anyways, access to information was a huge subject for volunteers, for social workers, and also for people that needed it. So I thought that it wasn't right, because there are actually quite a lot of resources, not enough, obviously, but there are some resources, and as a volunteer, I should be able to give this information. So I searched, and I found nothing, except sometimes some paper lists that we would pass around, but they were never up to date. So as David said, digital can be an incredible opportunity to access some new services. And Soliguide is kind of born from this clash of worlds, the one of new technologies and the one of social work. So Soliguide is actually a digital guide that references all the resources for homeless people and refugees. Sorry about my accent, by the way, because I'm very French. Before talking about our platform, I want to say that it's above all a huge database. So on the next slide, you can see that it's above everything. Talking about database is not sexy, because people want to talk about mobile app and everything, but it's really the core of what we do. Today, Soliguide database comprises more than 8,000, I think, different places across France that offer help, like shower, food, juridical advices, luggage storage, and so on. So then we are going to give this information with various supports. So this database is translated to a beautiful web platform, soliguide.fr, that you can go and see, even if it's in French. We also have an online chat, because sometimes what you're looking for cannot be translated by a single research. You have to talk to some real people to find the right information. We also have a mobile app that we launched earlier this year, and we have interactive kiosks. So the first challenge we have on the Soliguide project is that we want an updated information. because without a good information to give, everything else that we built on it is useless. So since we started Soliguide, it has been one of our main concerns. I don't know if it's only in France. I saw in the survey at the beginning that there are a lot of people that would work for NGOs and charities. But in France, actually, we have a huge turnover in the social structures that exist. There are a lot of them for like food distribution that will just close randomly, they will close for the holidays, especially in the summer. So it's really hard to keep track of everything. And for people that need them, it's kind of difficult. So we have to be able to change the information really quickly and regularly. So we made tons of processes with Soliguide so that we can automatically mail everyone, ask them every summer, every winter what's going on, so that we can give always the right information, because it's so important to give the right address, because for people on the streets, oftentimes they will find themselves finding a lot of closed doors. And if you add one more closed door to their face, it can be the end of the line for them sometimes. So then the next thing is that we have to be able to filter everything quickly, because as you probably know, poverty is really a wide subject. And we have people that live in poverty that are men, but also women, families, children. We have asylum seekers, refugees. We have people that are accompanied by a dog, and not every structure allows that. So we have really to be able to filter everything. And then we say that we have extended data, because what's really interesting with Soliguide is that we created this database with and for the homeless and refugees that use it. So they define the categories according to their needs. And for example, you're going to find on Soliguide classical stuff like food distribution, but you're gonna also find toilets and free Wi-Fi hotspots, because that's what they needed also. So then Soliguide also has an extended territory. We didn't want to have like one Soliguide for Paris, one Soliguide for another city, because people don't care where they either just need help. So we fought really a lot with activities to be able to have a national website and not individual websites for every single city. On Soliguide, we focus on having a very detailed information. We're quite proud of the quality of the information we give, because we not only give the timetable on the address of the places, we also are going to be able to give the nearest public transit stop, the access condition, the language that are spoken in it, and the contact information, everything. And then the next point is that we are a huge fan of UX design and ergonomy, because we made a risky bet with Soliguide, which is to have a platform, a single platform that is used by a lot of different people. So you're going to have homeless people and refugees using it, and that's already a lot of different usage. We are going to have social workers, NGOs, collectivities, volunteers like I was. So that's a huge challenge, because you have to give information in a way that everyone is going to understand it, and they don't all have the same understanding of digital tools. So now I gave you a quick overview of what we do, and I want to talk some more about digital exclusion, because maybe some of you are thinking this right now, but every time we would pitch Soliguide, there was always someone that would come up to us and say, that's nice and all, but you know that homeless people don't have smartphones, right? And it used to make us so angry, because we work a lot on the field, and we know that it's just not true. But the fact is that people have a lot of stereotypes about homelessness in general, but also with digital exclusion. But it all makes sense, because in the mind of a lot of people, a homeless person is like a 50-year-old old white man that have an alcohol issues. Well, that's what a lot of people think. We know that it's not true today. It's really diverse, and and homelessness is just a subject for everyone. But because of this stereotype and a lot of it, some people are going to have stereotypes and think that if you have a smartphone, then you are rich and you do not deserve to get help. I had some people that told me literally that they were spit on because they had a smartphone and were begging on the street because people don't think that's allowed for some reason. So it pissed us so much that we did a study on the subject. So it was in 2018. And we went across all of France and we interviewed a lot of people. And what we found out was quite surprising. We found out that 71% of homeless people that we interviewed had a smartphone. So when we talk about the homeless people in this study, it's people that are living on the street, but also people that are housed in emergency housing solutions. So it's kind of broad. And we had a lot of surprising information, apart from the number that 71% of them had a smartphone. We found out that having a smartphone is not the only issue. The other issue is also the connection. So there was only 29% of them that had a monthly phone plan. So the vast majority of them either had a prepaid phone card, which is kind of meh, or nothing. So having a smartphone does not mean that you can access the internet. Much more worrying, we also found that 58% of people that we interviewed could not do the administrative procedures themselves. It does not mean that they don't want to, it just means that the administrative procedures are all difficult to access because you need oftentimes a PC to get on it. It's often only in French, and these people can access WhatsApp and Viber and everything really easily because it's easy to use. And the government issued websites are not going to be easy to use because they did not think through about digital exclusion. So what we found that was really interesting also is that there was a lot of disparities according to the socio-demographic analysis. So for example, women found themselves to be a lot less skilled with digital tools than men. We don't know if that's because women are actually less skilled with digital tools or if they think they are less skilled. So that could be another study. And also we found out that migrants like asylum seekers had a lot more smartphone than French homeless people. And that makes sense because it's the last thing they're going to keep, because it's really important to be able to go through a new city and everything. So the study is fascinating, but it's also 150 pages long. So I will not be able to tell you everything about it here. But if you want to talk about it some more, so I will be delighted to talk about the results. We have the report on our website, solinum.org if you want, and I could translate it in English for you. I'm going to go back to Soliguide and tell you about our website, so you can have a bit of insights. So that's the website, and we have a very simplified Google-like research bar, as well as spectrogram. So mainly social workers that know by heart every single solution that exists on all the acronyms are going to type directly what they want in it. And people that are beneficiaries are often going to use the pictograms. So then users can navigate, and they have different categories. So for example, for food, you are going to find food distribution, but also food packages, social grocery stores, and fountains. And also you can filter by what specificities you have, like you want structures only for women, families, if you speak a certain language and everything. And then we also have online chat because, and we love it a lot. So you can find it on the bottom right of the screen. and people can just talk with us and ask us questions. And it's really important to us because we can understand what our users are looking for and also what problems they might encounter when they use the site, so we can understand what we're doing wrong, maybe. And then we also installed 2 interactive kiosks. Both of them are in France, in Bordeaux. So they are really interesting because they require no equipment. You don't have to have smartphone connection to access it. So one of them is in front of the train station. The other one is in a day shelter. And it also has the phone lockers, as you can see in yellow. Because the day shelter had a huge issue with people charging their phone and not having enough bags. So we designed this, and mainly the interactive kiosk gives the same information, it's just a lot more synthetic. So by giving you, our impact is that we give access to first necessities, we try to facilitate rehabilitation, and we coordinate everyone so that everyone can get a lot of time. And one of the impact that we like also is that we can have an overview of a territory, like a city, and we can just deduce that we need more of this kind of structure, more showers, and so on. So today we have more than 88,000 places to reference, and we did tens of thousands of researchers on the website. We are present in 8 French territories, and we installed 2 interactive kiosks on top of the website. What I would like to say with Soliguide is that we work with everyone, and that's literally. So you have a kind of collectivities that work with us, but the important thing is that we decided that we're going to listen to every single stakeholders with the design thinking method. So without going too much into detail, what it boils down to is that we are going to ask everyone how we can improve. And so Soliguide just keep changing every single day almost, because we want a tool that truly benefits everyone. And that's how we view digital tools. We think that digital exclusion is a real issue, and it also comes from the fact that we do not design the websites and platforms right. We have to use it in a way that can truly help people, and we have to ask them how we can design them. So I think that's it for me, and the message that I want to get out of this presentation is that I don't think that digital innovation, social innovation, and digital exclusions have to be separated. I think that they are the 2 faces of the same coin.
Okay. Thank you, Victoria. Thank you very much. I wanted, there are some, a lot of actually questions I see coming in from the audience. I think that would be really, really great that we can start to answering the question, and maybe in between lines, guys, David and Victoria, you can also say how do you actually, what was also your response to the COVID-19, and how does your service delivery look at the moment? But I would just go to the questions, because I think that this is one of the most important things, to get those questions answered. David, have you seen the question that was being posted to you? There was one question from Graciela.
Yeah, do you want me to?
David,
do you want me to read the question? Or?
I can also ask Graciela actually to read a question for you.
Yep.
If we can connect with Graciela, that would be really great. Maybe she has something to add as well to the question. Pauline, could you?
Hello.
Yeah.
Yeah. Hello.
Thank
you very much for the very interesting presentations. I learned a lot, and I am willing to transfer some of these into the NGOs that work with the APN in Spain, because we have this big problem of digital exclusion, which is not really covered by social intervention traditional projects. So this is a big issue here in Spain. The question for David was around what obstacles, including the practitioners themselves, did you find? And how did you manage to uncover them and overcome them?
Yeah, I think your question was around obstacles and resistance for some of the target groups and practitioners. So I'll focus on older people very briefly. I mean, there are many barriers to, you know, getting older people online and keen to get online. The challenges we face are around, if you know someone's offline, motivation is a big barrier. So just lack of engagement with the issue, with tech. So not really, you could have a tablet in your drawer, you're not really interested in using it. So how do we highlight the value of accessing that tablet and then online services on there? The other one is around security and trust. So there's a lot of fear mongering out there at the moment around anything involving tech. So big questions around privacy and trust. So there's a big challenge, big barrier for older generations wanting to get online. So we need to be really savvy at how we articulate a very simple message, reassuring message about the use of tech, and just simple tips to make sure that what you're doing is safe online. And then I would say the next one's probably lack of confidence and skills. So, you know, you might find that hook with them. There's a lot of patience required and repetition. Hence why we would advocate for an approach where you would have a carer or someone that's already part of their support network, if you like, to be able to bring in, help improve some of those skills and improve some of that confidence. I would actually say that for practitioners, it's a lot of the same barriers. So we're talking about the digital exclusion as if it's just a thing for service users and for these vulnerable groups. When we run workshops, you know, a lot of the staff and volunteers working for community organizations would be faced with the same barriers and wouldn't have necessarily the essential digital skills, we call them. There's an essential digital skills framework which measures you know, if you're at risk of digital exclusion. The same would apply for a lot of those carers or practitioners working in the field. So there's a big task of not just helping service users to feel reassured and to make the case for digital for them, but also for their practitioners and support workers and professionals in the field. Hopefully that answers your question.
Yeah, thank you very much.
Thank you. There is another question from Antonia to David. We can take it as well quickly. Antonia, could you ask your question? If Pauline. Hello? You cannot connect. Can we connect? I'm not sure. We can address the question. So Antonia asked how to deal with digital learning to elderly people when among them are a lot of them are suffering from dementia or other disability. Are you thinking to engage the carers as well? That was from Antonia to David.
Yeah, sure. So I'm aware of time, so I'll be brief. So Victoria can also answer some questions of hers. It's really challenging. Yes, we absolutely work with carers first of all. So we've got Carers Centre in the UK, we've got Carers Hub, we've got all sorts of great organisations that are supporting carers. The question is, are they themselves confident enough, and do they have the skills to feel like they can start talking about, start having a conversation with the people they're supporting who may have dementia? If not, then we have to work with them to again understand the value of how digital might help. There's a lot of great digital tools, apps, memory games, etc. For this particular group of people. So we would start working with them first. We also have specialist partners who, part of our network, who will really specialize in working with disabled people, for instance, or with people that have underlying health conditions. AbilityNet is one of them in the UK with whom we have close ties, and they will provide that kind of specialist learning and support, if you like, if we feel like the particular group of carers that are working with different client groups need that extra support and can kind of really harness some of those specialist tools and assistive technology tools, etc., for them. But initially we would just start with looking at which peer support these people have, and have those people got the skills and confidence to go and help the older people they're supporting. That's how we would try and bring a sustainable approach to helping those people, rather than go straight to the David the stranger going straight into an older person's home who's got dementia. It's just not going to work. So yeah, the challenge is working with those groups of people that are already supporting them, getting them to understand the value of this, why digital can help that client group, and then giving them the skills and confidence to do that with support from specialist partners.
Okay, I hope it answered your questions. If not, you can always contact David afterwards. I wanted to also quickly to address the question to Victoria. So Victoria, there's a question also like that, you know, homeless people have hardly any access to the internet, and how do you and the service that you provide. So how do you deal with that? How do you deal with the access to internet rather than and before you provide tools to homeless people?
So I think I already kind of answered it a little bit, but there is a reality that not every homeless person have internet connection and a smartphone, obviously. So what we do is that we go through the social structures, NGOs and charities that work with them. Actually, Soliguide is, I think, mainly used by social workers and volunteers. Obviously, the end users, homeless people and refugees also use it, but a little bit less. The main goal is to give information, so it doesn't matter which way you're getting it.
Okay, and now I had another question here. So, who are your biggest group of the end users, the biggest group of responders among homeless people? If you could, do you have such an information? Who would be that?
We don't have information about which kind of people use it more, because that could be not GPD compliant, I think. But what we can say is that we can see the statistics on Soliguide of the filters that are most used, and actually the filter women only and the filter families is used a lot of times. So we can kind of determine that there is a lot of women that are using it. Okay,
yeah, I understand. I wanted just to again come back a little bit to the current situation, to this the COVID-19 outbreak. Victoria, could you share with us how have you dealt and how are you dealing with the situation right now, so that you maintain sort of on providing those services and information to your target group? Can you give us a couple of examples?
Yeah.
What has changed, or what would you do differently, or?
A lot has changed. So in France, there is a lot of people that are unemployed for a short period of time because of the COVID. It's not the case at SOLINUM at all. We are in a spike of activity that like we never saw before, because information is really important, but it's even more important when everything is completely disorganized. Following the announcement of the government that there will be a lockdown starting on the 16th of March, most social structures closed. So we had a huge impact because we were able to update everything directly. So we have 83% of structures that are referenced on Soliguide that closed. That's a lot. And it was a lot of work to update everything, but it was rewarding because we had a spike in user users. So right now we have 8 more users than we usually do. That's because most of the time when you kind of know, you can go on the slide, when you know a service, you can go back, but right now everyone needs to check every day if it's still, if it's still open. So I'm quite proud of my team, and particularly the development team, because we developed a lot of new features. So we were able to update everything seamlessly. We had some updated information and, well, a lot of new stuff.
Okay, David, I know that because of the situation that we are, you also initiated some new activities within, also with the homeless group of people, address homelessness, right? Could you just shortly tell us what is it, and then people can follow it in the website?
Yeah, sure. So focusing on the Brighton and Hove project, I mean, there's been a huge kind of increased awareness suddenly of the needs of those vulnerable people that might be at risk of COVID-19 being in self-isolation or shielding. So a lot of them have received NHS letters saying you can't go out. Those people are also groups that are most at risk of digital exclusion. So there's a huge challenge there. In terms of what we're doing, we're we're looking at how digital champions can be supporting remotely. So we're looking at screen sharing, phone support. We've got a digital helpline. But we're really focusing on those groups that may not have a device or may not be connected yet. So there's a national campaign here, devices.now, run by the Department for Culture, Media and Sport. We've applied for devices, tablets. So we sourced some tablets to deliver to those vulnerable groups that are either shielding or don't have internet access or don't have a connection. We're working with homelessness charities in Brighton. So we've delivered already some devices to those that didn't have any, that are in emergency accommodation. And we're looking at innovative means of providing Wi-Fi for them. So rather than going through a broadband provider or SIM cards, we're partnering up, and this has not been confirmed yet, but with Jangala, who are a company that provide emergency Wi-Fi in situations of humanitarian crises across the world. And COVID-19 is a slightly different situation for the UK, but it's still a situation of emergency. So they're adapting their tech so that you can put a SIM card into their Get box, Wi-Fi box, and that means up to 14 users can use that data on the SIM card. So instead of having 15 SIM cards, you've got a little portal, little kind of hub. And we're putting those in some emergency accommodation for homeless people, hopefully very soon. So it's kind of thinking about, fast tracking the things we normally think about, getting devices out there, ensuring there's support for those that aren't used to the devices. So what does that support look like? And then making sure they've got a kind of affordable, funded connection using new tech. So that's quite an exciting thing. We don't know if it's going to work. We're going to try it out. And then nationally, we've done a lot of mapping work, identifying those GP surgeries, so doctors' surgeries, which have low level of uptake of online services, and which have a high density of older people in different neighborhoods. So we can kind of pick out the kind of digital exclusion hotspots, if you like, and where you need to go and increase the support based on that mapping, which we saw on the slide quickly there. And we're doing loads, and we're bringing our networks together. So we're doing a webinar right now in parallel, bringing different local authorities, towns and cities to explore how we deal with increased demand and make sure that the right people get the right support with the same resources. So you know, there's a lot of that, and a lot of webinars on the online accessibility. How do you support someone remotely? We're doing them weekly, and they're open to everyone. So just I'll put the link in the follow-up. You can just sign up and learn from practice in the UK.
I saw loads of regular webinars at your website, and some of them I joined them as well. Thank you so much. We are running out of time, so I'm aware that we passed the time. But thank you so much to you both, David and Victoria. And again, we saw that digital inequality matters because, you know, those without access to digital are missing out in all areas of life, and you know, digital exclusion isn't going away, and it's not simple to resolve. but yeah, the biggest sort of one of the biggest things is to basically join forces and try to resolve them together, across borders, across organizations, across sectors. Thank you very much for my guest. And just practical thing. I know that of course, there's not a lot of always enough time to answer your questions, but you can go to our forum on digitalexclusion.eu and you can post your question there. And our guests, Victoria and David, will gather those questions and they will be steadily answered there. So don't hesitate. Visit our website, Digital Inclusion, our community, sign up and participate in the forums. And we are going to post there some news about from also organizations of Citizens Online and SOLINUM, and follow us. And for the next tweet, for the next webinar episode, and follow us on Twitter, Facebook, and LinkedIn. You can connect everywhere. We are present in the digital world. Thank you so much for making this time to us, and hopefully to see you soon. Have a good afternoon. Have a good bank holiday for those who are in the UK starting tomorrow. Bye-bye.
Bye.